More on this now from Darren Hughes, who's director of the Welsh NHS Confederation. I get the impression, Mr. Hughes, that for you there isn't much of a break. It's still all hands to the pump for what might come. Hopefully it won't, but what might come later on in the year.
Very much so. It was welcome news to hear the extra funding for the NHS in England, and obviously there are sort of consequential changes then for the budget in Wales. But this money, if we're looking at, an estimate at the moment, if roughly 150 million are likely consequentials. If you look at what's been spent on field hospitals so far, it's round about 160 million. And this isn't just about dealing with COVID as well. The extra costs have been incurred in trying to switch back on the NHS for all of the other urgent services that the population in Wales need.
Do you feel you're in a better position now to deal with any spike in cases in the autumn or the winter than you were when it really hit back in March?
I think if we look back to March, and it seems like a long time ago, but it only seems like yesterday, we had Councillor Morgan talking about the reasonable worst-case scenario. What we were looking at then was the NHS and social care systems potentially being overwhelmed. Huge work went in, and great credit to the staff and organisations we work with to increase bed capacity, increase staff capacity. And we are very much in better shape, but we still need to deal with usual winter pressures. And there have been an awful lot of people who haven't been diagnosed with quite serious conditions. We've heard, from cancer charities about their concerns, from the British Heart Foundation about their concerns. It's about keeping people fit and well with other health conditions other than COVID, but also being totally prepared should there be a resurgence, as some people are predicting in the autumn.
I know no one has a crystal ball, but if you look for the rest of this year now, up to December, perhaps into January, February as well, is there any chance of any kind of normality returning to the health service? I'm thinking there of things like hip and knee replacements, things like cancer services that have been put on the back burner, or is 2020 just a pause, really, in those services as we know them?
I think I'd, very much like to reassure listeners that, my colleagues across the NHS are doing everything they can do to get these other services switched on. But it is going to be hugely difficult. Every clinical intervention, the staff are going to need to have personal protective equipment on. We need to do what we can within hospitals, which is reducing capacity significantly to comply with social distancing regulations. So we're doing all we can, but I would ask the public to, understand that we're doing the best we can with the resources we've got.
And look, I know there's an awful lot going on, but from your point of view, with all those preparations, what is I don't even know if you can narrow it down to this, what's the single most important thing that you personally think the NHS is doing at the moment to prepare?
I think what we're doing, what we rely on is staff, and we've heard the First Minister say today that staff should try to take a break because these people have been working, going the extra mile day in and day out, so we need to do everything we can to support the staff. We're making all the preparations we can for a resurgence, and still working round the clock to get other healthcare services, not just in hospitals, but other healthcare services delivered within the community.
Good to speak to you. Thank you very much. That's Darren Hughes from the NHS Confederation.